I do want to start at the very, very top, which is going to be phones. And phones to me are where we set the stage for what that patient can expect when they come into our office. And so I want to talk through all the different things that make a phone call either good, great, or terrible. What are your first thoughts when I mention phone calls?
I think it's interesting because, first of all, yes, the phone call matters the most. When I call somewhere and if I can tell they're distracted or if I have to repeat myself 10 times or if they don't even answer the phone, let's start there. There's this phone tree that I've got to go through 8 different options and then I don't remember which option was I supposed to pick 4 or 5. And now like that already, I'm already annoyed. I'm already annoyed. I'm already thinking maybe this is not the office I want to go to. So trying to make it as easy as possible to get the patient to where they can schedule.
Mhm.
And I think it's funny though, and I'm not going to say there's a right or wrong per se. Maybe you can tell us if it's right or wrong, but I've heard different arguments of, well, we do need to collect all their insurance information and all their details of what is their concern and reason for coming in today. Because if we don't get that, then now they feel like we've hoodwinked them later if we don't take their insurance and we've spent all this time and now they've wasted their time coming to our office. So
Mhm.
some people will argue that. Some will say, no, we need to spend time to get to know them on the phone so that they already feel like we know them when they come in. I'm not a strong proponent of that, but that's, another philosophy. So the point is, have you thought about what you feel like what is important to you in your office? And how are you ensuring that your team is executing that vision? Because again, there's different philosophies and methods of how you think you should enter the phone. I'll let you kind of tell us what you think.
I think you're exactly right. I think we've got to come together as a team and agree on the things that we are required to get in that new patient phone call or any phone call subsequently after that. So things to me that are important, bare minimum things, and then we can build or take away based on these themes. We've got to obviously build some type of connection with the patient that does not require a lot of details. To me, connections can be built pretty quickly by one simple tip, which is just use the patient's name. Repeat that name back. So if you're asking at the beginning of your phone call, oh, who do I have the pleasure of speaking with? And the person on the other end says, Joe. Okay, remember that. Remember that you're talking to Joe and incorporate Joe's name a couple different spots throughout the phone call. And it's not magic, but somehow it magically works to make Joe feel a little bit more connected to you in that phone call and doesn't require you asking all of these deep, long questions to get to know Joe. But using the name and
Just as a personal touch.
yes, it adds that personal touch and people love hearing their names and it's something very positive. So I would encourage you get that name at the very top of your phone call. Don't wait. A lot of times I'll hear teams that they'll just dive into, okay, what are we seeing you for? What do you need? Blah, 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 blah. And then we don't even know who it is until the end. Oh, and can I get your name and date of birth? And I'm like, oh no, that is so backwards because now we've missed the opportunity to use Joe's name throughout the phone call. So that to me is a bare minimum that we need to include. But also, this is where I think we miss a lot of details. If Joe is calling in because he's got a toothache, let's say, and so you say, "Oh, who do I have the pleasure of speaking with?" "Oh, my name's Joe Jones." "Joe, it is so nice to meet you. What prompted you to call our practice?" "Well, I'm having this awful toothache," and he goes on and describes this toothache, which they often do when they've got a problem. And let's say that I'm on the other end of the line and I'm distracted. I'm thinking about this lady that's checking in, team members trying to talk to me, and I've missed some of Joe's details that he's shared with me. And then I go, okay, so we need to get you in to get that tooth looked at. Now, is it keeping you up at night, Joe? And Joe's like, I just clearly said that I haven't been able to sleep with this toothache. And so we can sometimes zone out when patients are sharing maybe too much information. We get that. Like, patients will just start to verbal vomit on you. And we have a tendency to just tune out because we're focused on a lot of other things in the practice. But that sets the tone for the fact that we're not going to be paying attention to Joe when he comes in. If we say something as simple as Joe just verbal vomited about his toothache, and then we go, "Oh, Joe, wow. First of all, I'm so sorry that you're having that toothache. That sounds miserable. It sounds like it's keeping you up at night, throbbing even during the day, but especially at night. So I definitely want to get the doctor to take a look at that as quickly as possible." We've just repeated back to Joe what the issues are with some of the specific details that he's used.
I think in our office being pediatrics, I think for me, one of the most cringeworthy things I can hear when we go back and do call audits. Yes, my kid was on the playground and nurse just called me and she fell and there's a lot of blood. Oh, okay. So did you want to come in today? And I'm just like, are you kidding me? Like somebody's just calling. They're clearly panicking because their kid fell and just to go, oh, okay. I just think that's awful.
Yeah.
Like we need to, that to me is poor customer service.
Yeah.